Welcome to the RPT Realty Benefits Enrollment for the 2023 plan year. The benefits you hear about today and the elections you make during this enrollment will be effective January 1st through December 31st. If you are a new hire, your benefits will be effective on the first of the month following 30 days of employment. Open enrollment happens once a year, and it is your opportunity to learn more about your benefits, make changes to your benefit elections, add or remove dependents, and enroll in new coverages. RPT Realty is proud to provide employees with a comprehensive benefits package. Benefits are available to full-time employees and their dependents. We offer medical insurance with Blue Cross Blue Shield of Michigan. We offer 2 PPO plans and a high-deductible health plan with a health savings account option. Our health savings accounts are administered by Health Equity. The pharmacy benefits are administered by Optum Rx. Our Blue Cross Blue Shield medical plans include a diabetes and hypertension management well-being benefit called Livongo that helps employees build healthier lifestyle habits and includes a personal health coach. The flexible spending accounts are administered by Basic. We offer vision coverage with Blue Cross Blue Shield. Our dental insurance is with MetLife and will include 2 plan options for you to choose from. Our life and disability coverages are with Hartford. You and your family members have access to an employee assistance program with Metropolitan Family Services at no cost to you. We also offer accident and critical illness plans with Guardian. RPT Realty is now offering a new pet insurance policy with Nationwide. Additionally, you are offered a cyber and identity theft protection plan with Allstate that protects you and your family from online security threats, identity theft, and much more. Please note that Eden Health telemedicine service will no longer be offered as of January 1st. Over the next few minutes, we will review our benefits package in more detail. All of the information provided in this video is available in greater detail in our benefits guide. Contact information for all of our insurance carriers and benefits consultants at Highland is also included in the guide. Be sure to review this guide before making your elections. You will enroll for your benefits using the BenExpress online enrollment system. Log in with your username and password using the format shown here. Please note that the username and password should all be lowercase. The BenExpress system will guide you through all benefit plans for you to make your elections. When you are finished, you may save or print a copy of your confirmation statement for your records. If you elect a coverage that requires an evidence of insurability form, you will receive an email from Hartford with a link to your personal evidence of insurability form to be completed online. Please note that detailed benefit summaries and other important benefit information can be found in the resources section of the BenExpress system. All of our medical plans cover the same services and utilize the same network of providers. The plans all cover in-network preventive care services at 100%. There is no cost to you for annual physical exams, well-woman, well-man, and well-child exams, including preventive lab work. Preventive mammograms, prostate exams, and colonoscopies are covered after you reach a certain age threshold. Generic contraceptives are also covered at 100%. And finally, don't forget that annual flu shots are covered at 100%. We encourage all employees to take advantage of our preventive care coverage and seek routine checkups. If you discuss any symptoms or ailments you are having with your doctor during your routine annual physical, they may bill you for the office visit and it is no longer considered a preventive exam. Diagnostic labs and x-rays performed at your physician's office or a freestanding lab or a diagnostic testing center will be covered at 100% in the PPO plans and subject to the deductible in the high deductible HSA plan. If you have labs or x-rays performed in a hospital, the charges will be subject to the deductible and coinsurance, and your cost will be significantly higher for those services. We encourage you to have labs and x-rays done at your doctor's office or a freestanding facility to save on out-of-pocket expenses. The Buy-Up PPO offers copays for physician office visits, psychiatry and counseling visits, urgent care centers, emergency room visits, and prescription drugs. Medical services such as major diagnostic testing, inpatient hospital stays, and outpatient surgery are subject to a calendar year deductible of $1,000 per person for single coverage and $2,000 if you cover dependents. After you meet the deductible, Blue Cross Blue Shield will pay 80% of covered in-network services that are not subject to copays, and you will pay 20% up to an out-of-pocket maximum of $4,000 for single coverage and $8,000 for family coverage. The out-of-pocket maximum includes the annual deductible, coinsurance, and all copays. After you have met your out-of-pocket maximum, Blue Cross Blue Shield will pay 100% of eligible in-network medical services for the remainder of the calendar year. The plan covers out-of-network benefits, however, they will be subject to a separate and higher deductible and out-of-pocket maximum. The second PPO plan is called the Core PPO plan and offers the same copays as the Buy-Up PPO plan. In this plan, services not subject to a copay will apply to the deductible of $2,500 per person for single coverage and $5,000 if you cover dependents. After you meet the deductible, Blue Cross Blue Shield will pay 80% of covered in-network services that are not subject to copays, and you will pay 20% up to an out-of-pocket maximum of $8,150 for single coverage and $16,300 for family coverage. The out-of-pocket maximum includes the annual deductible, coinsurance, and all copays. After you've met your out-of-pocket maximum, Blue Cross Blue Shield will pay 100% of eligible in-network medical services for the remainder of the calendar year. The plan covers out-of-network benefits, however, they will be subject to a separate and higher deductible and out-of-pocket maximum. This plan will cost you less per pay period than the Buy-Up PPO plan, but your out-of-pocket exposure is higher. The HSA plan covers all non-preventive medical services and prescription drugs subject to a calendar year deductible of $1,500 for single coverage and $3,000 for dependent coverage. The deductible for dependent coverage is non-embedded, meaning the entire $3,000 deductible must be met before the plan covers services for anyone in the family. After you meet the deductible, Blue Cross Blue Shield will pay 80%, and you pay 20% of all eligible network medical services, and prescription drugs will be subject to copays until the out-of-pocket maximum has been reached. The out-of-pocket maximum is $3,500 per person with a $7,000 family maximum, and includes the deductible, coinsurance, and pharmacy copays. After you've met your out-of-pocket maximum, Blue Cross Blue Shield will pay 100% of eligible in-network medical services for the remainder of the calendar year. The HSA plan also includes out-of-network benefits. However, these services will be subject to a separate and higher deductible and out-of-pocket maximum. When trying to decide which medical plan to enroll in, please consider the following things. How often do you use the doctor? And what are the typical services that you need? How much is the premium cost per pay period you are willing or able to pay? How much is the out-of-pocket maximum for the calendar year? And are you able to pay it in the event of a high-cost claim? Are you interested in the tax savings and the ability to save money for healthcare expenses by contributing to a health savings account? Thinking through these questions and weighing your options will help you make the best financial decision for you. When you are making your benefit elections, you must attest to whether you and/or your spouse, if covered on the medical plan, are a tobacco or non-tobacco user. We support tobacco users in their efforts to quit. Therefore, we are giving them the opportunity to move to a non-tobacco status during the plan year by providing certification from a physician documenting they are no longer using tobacco products. Prescription drugs are categorized within tiers. Each tier is assigned a copayment, the amount you pay when you fill a prescription. Mail order service is also available for a 90-day supply of maintenance medications, and this setup can save you money. We encourage you to use generic medications. They cost you less and help us control the cost of our health plan. Research and discuss your medications with your doctors. You can obtain generic prescriptions for $4 by using the pharmacy at Walmart, Target, and other retail pharmacies by not showing your health insurance card. At some pharmacies, certain generic medications are available at no cost. Please note, if you elect the Simply Blue HSA plan, copays for prescriptions do not apply until you meet your annual deductible, with the exception of preventive medications. Blue Cross Blue Shield will pay 100% for preventive medications, such as treatments for high blood pressure or high cholesterol when provided by in-network pharmacies, up to an annual maximum of $500. Preventive medications are not subject to deductible or copay requirements until the benefit maximum is reached. Please see your benefits guide for more details. The Blue Cross Blue Shield prescription programs include 2 cost management programs, step therapy and prior authorization. These programs are designed to help you manage your prescription drug costs. The step therapy is an automated process that provides coverage for more affordable drugs before extending coverage to other more expensive medications. This ensures all clinically sound and cost-effective treatment options are tried before more expensive drugs are prescribed. Prior authorization means that review of certain drugs is needed before your plan will cover them. This ensures patient safety, lower cost, and high-quality care. If your doctor does not get prior authorization when required, your drug may not be covered. These programs will only apply to new medications filled. They will not apply to refills on medications you are currently taking. You have several pharmacy resources available to you when filling a prescription to help you save money. OptumRx allows you to order up to a 90-day supply of a covered drug for 2 copays through their mail order program. Simply ask your physician to write you a new prescription for a 90-day supply. For more information, visit OptumRx.com or call 1-800-356-3477. GoodRx is a website and mobile app that allows you to compare prices for your prescription at pharmacies near you. GoodRx will show prices, give coupons, discounts, and saving tips for your prescriptions. When you use a coupon from GoodRx, your out-of-pocket cost does not apply to your medical plan deductible or out-of-pocket maximum. Also, remember, many pharmacies now offer discount prescriptions that are often even lower than your copay. Our benefit program includes convenient online tools that should be utilized. The Blue Cross Blue Shield website provides access to your claims and copies of explanation of benefits. You can also find a network doctor or hospital, compare treatment costs, and more. Blue Cross Blue Shield also provides a mobile app. With the mobile app, you can conveniently access your virtual ID card, review your benefit and claim information, find providers, and more. RPT Realty offers additional lifestyle benefit programs at no cost to eligible employees and their adult family members who are enrolled in the Blue Cross Blue Shield of Michigan Health Plan. The Livongo Diabetes and Hypertension Program provides eligible participants with an advanced blood glucose meter, unlimited test strips, personalized meal plans, weight management assistance, and 24/7 expert support through a personal coach. Livongo is available to employees and their covered dependents that are pre-diabetic or have been diagnosed with diabetes or hypertension who are also enrolled in the Blue Cross Blue Shield Health Plan. You can sign up as of February 1st by calling Blue Cross Blue Shield at 1-800-945-4355 or online at join.livongo.com/BCBSM/register. Our Blue Cross Blue Shield medical plans offer convenient virtual or telephonic healthcare 24 hours a day, 7 days a week. There is a $10 copay per visit if you are enrolled in the PPO plans, and $59 until the deductible is met if you are enrolled in the HSA plan. Through the online visit, you will discuss your symptoms, and the doctor can diagnose and treat a wide range of non-emergent medical conditions and even call in a prescription. Online visits are especially convenient for those times you are unable to leave work, you are traveling out of town, or your primary care doctor does not have any openings. Download the Online Visits app or go online, add your Blue Cross Blue Shield healthcare plan information, use the service key BCBSM, and choose an available doctor who is right for you. At the end of the visit, you will get a full report to share with your primary care doctor. This is available to all family members on your medical plan. Just add children under the age of 18 to your account. Your spouse and children age 18 and over should create their own account. If you enroll in the HSA plan, you may contribute tax-free dollars to a health savings account administered by Health Equity. A health savings account is your personal bank account. Funds in the account may be used to pay for medical, dental, or vision expenses for you or your dependents, even if your dependents are not covered on the medical plan. You may also purchase over-the-counter medical supplies and medications with HSA funds. Please take note of the maximum amount that may be deposited to your health savings account in 2023. RPT Realty will deposit $400 to your HSA if you have single coverage, $600 if you cover one dependent, and $800 if you have family coverage. Keep all receipts for payments made from your HSA, as this is an IRS auditable account. Using your HSA to pay for ineligible expenses can result in a tax penalty. If you are over age 65 and covered by Medicare, covered under TRICARE, or covered under another medical plan that is not an HSA qualified plan, including a healthcare flexible spending account, you are not eligible to contribute to a health savings account. Our Section 125 plan allows you to make your contributions for medical, dental, and vision premiums and HSA or FSA contributions on a pre-tax basis. This reduces your federal and state tax liability and increases your take-home pay. Our flexible spending accounts are administered by Basic. We offer a healthcare account and a dependent care account. A healthcare account allows you to make pre-tax payroll contributions to pay for medical, prescription, over-the-counter medications and supplies, as well as dental and vision expenses for yourself and your spouse or children. Your annual contribution will be deducted in equal amounts throughout the year, yet you will have access to your entire election on January 1st, or your new higher benefits effective date. Once you make your annual election, you cannot change it until next open enrollment, unless you have a change in family status. Keep in mind, any balance over $610 left in your account at the end of the year will be forfeited. Be sure to estimate your medical, dental, and vision expenses wisely to avoid a loss. If you contributed to the FSA in 2022, please file any claims for expenses no later than 60 days after the end of the plan year. If you contribute to a health savings account, you cannot also contribute to a healthcare flexible spending account. You may, however, contribute to a limited purpose FSA, which allows you to pay for dental and vision expenses with the FSA, allowing you to use your HSA for medical expenses. The maximum amount that can be contributed into your medical care flexible spending account or limited purpose flexible spending account is $3,050. If you participate in our wellness program and qualify, RPT Realty will contribute a maximum of $180 per year if you have single coverage, or a maximum of $360 per year if you cover dependents. If you are enrolled in the HSA medical plan, the money will be deposited in your Health Equity HSA. If you are enrolled in a PPO medical plan, or you waive the medical plan, the money will be deposited in your Flexible Spending Account, FSA. The Dependent Care FSA allows you to set aside funds to cover daycare expenses for children under the age of 13 or for a disabled dependent of any age so that you can work. Funds will be deducted from your paycheck on a pre-tax basis. Funds in the Dependent Care FSA can only be used as they are deposited. We encourage you to review your personal tax situation, as you cannot use both the Dependent Care Flexible Spending Account and the Dependent Care Child Tax Credit when filing your personal income taxes. Please take note of the annual maximum amount you can contribute to your Dependent Care Flexible Spending Account. Our dental insurance is with MetLife. You have the option to enroll in a base plan or a buy-up plan. Both plans cover services received from network and non-network dentists. By utilizing network providers, you will receive the highest level of benefit and save on out-of-pocket costs. Charges from out-of-network providers are higher than the negotiated fees charged by network dentists, and non-network dentists may balance bill you for the amounts not paid by insurance. For this reason, we encourage you to use network providers as much as possible. When you use a network dentist, the buy-up plan covers preventive services at 100%. Basic services such as fillings, periodontics, and simple extractions are covered at 100% after the deductible is paid, and major services such as bridges, crowns, and dentures are covered at 60%. After the deductible is paid. The buy-up plan includes orthodontia coverage for children up to age 26, which is covered at 50% to a lifetime maximum benefit of $1,000 per covered child. The calendar year deductible is $50 per person to a family maximum of $150 and applies only when you have basic or major services done. The maximum benefit that MetLife pays in the buy-up plan is $5,000 per covered person per calendar year. The base plan covers preventive services at 100%. Basic services such as fillings, periodontics, and simple extractions are covered at 80% after the deductible is paid, and major services such as bridges, crowns, and dentures are covered at 50% after the deductible is paid. The base plan does not include orthodontia coverage. The calendar year deductible is $50 per person to a family maximum of $150 and applies only when you have basic or major services done. The maximum benefit that MetLife pays in the base plan is $1,500 per covered person per calendar year. MetLife does not mail ID cards, but you don't need to have an ID card to receive services from your dentist. Simply tell them you are a MetLife covered member and give them your Social Security number, and they can verify your coverage. MetLife gives you convenient online access to your benefits. By registering online, you may review your benefits, check the status of a claim, find network providers, and even print your ID card. MetLife also offers a mobile app that gives you convenient access to view your ID card, find local network providers, and more. Our vision plan is with Blue Cross Blue Shield using the Vision Service Plan Network. If you use a network optometrist, you will pay a $5 copay for a routine vision exam every 12 months. Most lenses and frames are available for a $10 copay. The plan covers lenses every 12 months and frames every 24 months. If you choose contact lenses in lieu of glasses, the plan will cover the cost up to $130 once every 12 months. If you use a non-network provider, you will be reimbursed for your services up to a scheduled amount. RPT Realty provides all benefit-eligible employees with base life and accidental death and dismemberment insurance at no cost to you. Your benefit amount will equal 1 times your annual pay, not to exceed $250,000. Benefits reduce starting at age 70. RPT Realty also covers the cost for a $5,000 life insurance benefit on your spouse and coverage on your eligible children in the amount of $2,500. You may purchase additional voluntary life and accidental death and dismemberment insurance through Hartford for very low group rates. Voluntary life insurance can be elected for yourself in $10,000 increments, up to 5 times your salary, not to exceed $500,000. You may purchase $5,000 increments on your spouse, not to exceed the amount you elect on yourself, or $500,000. Additionally, you may purchase $2,500 increments on your dependent children, not to exceed the amount you elect on yourself, or $25,000. Any new or increased voluntary life insurance election during open enrollment will require you to complete the evidence of insurability form and approval by Hartford. Benefits reduce beginning at age 70. You can also elect voluntary accidental death and dismemberment coverage on yourself without evidence of insurability in the amount of $10,000 increments, up to 5 times your annual salary or $500,000, whichever is less. You can elect AD&D even if you don't elect voluntary life insurance, and no evidence of insurability is required for AD&D coverage. RPT Realty covers benefit-eligible employees with short-term and long-term disability at no cost to the employee, which pays you a portion of your income in the event an accident or illness prevents you from working. Short-term disability provides 66 2/3% of your pre-disability income to a maximum biweekly benefit of $4,154. Employees with 1 to 5 years of continuous service will receive 100% of earnings for 2 weeks and 66 2/3% of earnings for the remainder of the short-term disability period. Employees with over 5 years of continuous service will receive 100% of earnings for 5 weeks and 66 2/3% of earnings for the remainder of the short-term disability period. Benefits begin on the 8th day of disability. Benefits may continue to be paid while you are disabled for up to 90 days. The short-term disability plan does not cover work-related accidents or injuries, but it does cover approved maternity leave. There is no pre-existing condition limitation for this coverage. If you are still disabled and unable to work at the end of 90 days, the long-term disability insurance will begin paying a monthly benefit of 66 2/3% of your monthly income, up to $12,500 per month. Benefit payments begin on the 91st day of disability. Benefits are payable for 24 months if unable to perform the duties of your occupation, or Social Security retirement age if unable to perform the duties of any occupation. There is a pre-existing limitation on this coverage. Benefits will not be payable for any condition that exists within 3 months prior to your coverage effective date, until you've been covered under the plan for 12 months. Please see your benefits guide for more details. You and your family members also have access to our Employee Assistance Program with Metropolitan Family Services. The EAP is a free and confidential service provided to you at any time to help you maintain a healthy, balanced work and personal life. Whether you need assistance with life challenges such as relationship issues, coping with aging parents, or dealing with financial, legal, or emotional concerns, our EAP is staffed with fully licensed and caring professionals to ensure you find a resolution. The EAP includes 3 in-person counseling sessions at no cost per member, per problem, per year. The EAP will work with your insurance to help you find a local counselor that accepts your medical insurance if you continue your visits. Contact information for this service is provided in your benefits guide. Our Hartford insurance coverages offer value-added services, such as a travel assistance program, including emergency medical assistance, identity theft detection and resolution services, and pre-trip information. Also, you have access to estate planning and will preparation services. Review the details in your benefits guide. We offer 2 voluntary worksite plans. You can enroll in the Guardian Accident Plan and/or critical illness plans. You can cover yourself and your dependents. The accident plan pays benefits directly to you for medical services you have done as a result of an accident. Benefits paid to you help you pay for expenses associated with an accident, such as deductible, coinsurance, and lost wages. Here are just a few of the benefits our accident plan provides. This coverage is guarantee issue. You do not have to answer medical questions. The critical illness plan pays benefits directly to you in the event that you are diagnosed with a covered illness. The benefit can be used to help pay for your medical plan deductible, living expenses, or any way you see fit. You choose to receive a benefit of either $10,000 or $20,000 for yourself. If you cover your spouse, they are covered at 50% of the employee's benefit amount, and children are covered at 25% of the employee's amount. You can enroll in new coverage during open enrollment or increase your current coverage without having to complete a medical questionnaire, as long as you are under age 70 at the time of electing coverage. Please see your benefits guide for more details. We are excited to now offer pet insurance with Nationwide with preferred pricing, and the cost is payroll deducted from your paycheck. The plan has a $250 annual deductible that must be paid before the plan begins paying benefits. You can receive up to $7,500 in annual benefits. You choose a reimbursement level of 50% or 70% for services such as accidents and injuries, illness, surgery, x-rays, and so on. To use your pet insurance plan, visit any vet of your choice, pay for your services upfront, then submit a claim to Nationwide for reimbursement of eligible expenses. To enroll in this benefit, you will use the link on the pet insurance page in BenExpress to enroll directly with Nationwide, or you can call 877-738-7874. You will receive a welcome kit from Nationwide with your policy and rate information, claim filing instructions, and contact information for Nationwide. We now offer cyber and identity theft protection through Allstate. This plan includes multiple levels of cyber, ID theft, and financial protection, including credit and debit card monitoring, mobile device and app security, elder fraud protection, computer protection, and much more. When you sign up for the family plan, this plan protects the family members under your roof, as well as parents, grandparents, and in-laws that are over age 65. See your benefits guide for more details. We are proud to present this benefits package to our employees. Now it is time for you to take action. Be sure to review the benefits guide. Complete your benefits enrollment before the deadline in BenExpress, even if you are waiving all coverages. Remember to use the tools available to you from Blue Cross Blue Shield, MetLife, and Metropolitan Family Services, EAP. Take advantage of the enhanced Livongo benefits. Utilize in-network providers for our health, dental, and vision insurance plans to maximize your benefits. Be sure to use generic medications and maintain healthy habits. If you have any questions about your employee benefits plans or need assistance with open enrollment, please contact our benefit consultants, Highland, toll-free at 888-578-9988. Thank you.